Are we good?
Yes, sir.
Great. Thank you, everybody, for coming here today. I'm Senator John Mannion, and I'm proud to chair the Senate Standing Committee for Disabilities, and I'm joined by Senator May, Chair of the Aging Committee, Assemblyman Al Sturpey, who's Chair of the Small Business Committee. You're going to hear from many different individuals here standing with me today because they're either experts in home care or they have personal experiences in navigating the home care system. So today is about saving services for the elderly, those with disabilities, and those with mobility issues, and saving jobs in Onondaga County and Central New York. But more importantly, or just as importantly as saving those jobs in Central New York, it's about having local providers who have the connections, who have the deep connections and the deep roots, and who know our community and know the individuals that are in our community. They can best serve them. And that's why we're standing here today fighting for our providers and fighting for all New Yorkers. So to take a line from President Biden, tens of thousands of New Yorkers rely on home care services. These are people that come into the home to assist seniors or people with disabilities. It's a position of trust and can involve intimate tasks such as bathing, but also things like cooking and cleaning and doing laundry. It is an absolutely critical part of healthcare and the continuum of care. This program helps individuals stay in their home, avoid hospitalization, or avoid moving into a nursing home. Hospitalizations in nursing homes are, as we all know, extremely expensive and not designed to provide a level of independence and appropriateness of care for these individuals. There's an infrastructure around these services that has been working, and it's been working because community organizations, local providers are providing those services. They know the people that they're working with, and they know other organizations that can help when they might not be able to provide those services. So the people managing the services are a part of the community. They live here, they work here, they know the people personally, they have relationships, they can pick up the phone, and they can solve a problem. The programming I'm speaking about is called the Consumer Directed Personal Assistance Program, or CDPAP. It's a New York State program that's overseen by our state. But the state wants to make some changes that many of us believe are in some ways unnecessary. And one of those changes would be to leave Onondaga County with 0 fiscal intermediaries. Those fiscal intermediaries are necessary. Our local voluntary providers are providing that service now. And this is very, not only disheartening, but it's just simply wrong. The state is trying to decrease the number of lead fiscal intermediaries across the state, and they've decreased it, at least preliminarily, to a number about 60. We want to make sure that that number is expanded and includes our local community partners that have been providing the service for a long time. They are long-standing, trusted members of our community. These are organizations like Access CNY, True Care Connections, Arise, and others, and they will no longer, under the current selection process, be functioning as fiscal intermediaries. CDPAP serves over 130,000 individuals across the state, and I joined along with Senator May and Assemblyman Magnarelli earlier this year in a call with the governor's office about our collective concern of making sure of what that program and the FI program looks like in Central New York, and that there is a presence of our local providers involved. As a result, I introduced legislation, which Senator May co-sponsored, that was included in the state's One House budget proposal, and would expand the number of lead fiscal intermediaries for geographic diversity and diversity in clientele, such as individuals with disabilities, new Americans, or minority populations. This legislation was the genesis for the agreement that ultimately ended up in the New York State budget. But the Department of Health is not interpreting these rules how the legislature had intended, which was to prevent unnecessary cuts. It's important to keep these services local. It's bad policy to change the structure that is in place that's working for individuals. We have to save the CDPAP program. We have to continue that local providers are the administrators of these services and not have them outsourced to places around the state or even worse, outside of the state. When I saw the list of preliminary selections for providing these CDPAP services for the FIs that were selected, the names were unfamiliar to me. They were not the names that we've come to know and trust and have served our community for generations. So this is just not going to work in the current manner through that selection process. It's not going to work for our community. It's going to be terrible. And at the end of the day, it's going to be the people who rely on these services who are going to suffer. And it's going to eliminate, as I said at the beginning, good jobs in Central New York and that delicate community touch that we need so desperately and that works so well. So we're calling the governor back to the table to address this issue and redevelop the plan to maintain the CDPAP program and the services that are provided by it. We can pursue a legislative remedy to this, but we're hoping that communication and negotiation is enough to get us back to the place where we need to be. So I'm optimistic that our voices will be heard, common sense will prevail, and the resulting selection will be that our local providers who have these relationships already are the ones in Central New York providing the services to our Central New Yorkers. With that, there's many others that need to share their story, and we will start with founding board member of Statewide Advocacy Group for Home Care, Rick Alvarado, who's been a strong voice to save and improve the CDPAP program. Thank you, Rick.
Thank you, Senator Mannion, Senator May, for having me here today. I have not brought anything prepared to speak, so I won't be looking down too much. But I am very passionate about home care. I'm very passionate about the CDPAP program and about what it does and what it enables individuals who are dealing with the difficulties and real struggles of aging with disabilities that afflict us. Healthcare, home care is part of a continuum of services as we age, and it fills a very important need. It allows individuals to maintain dignity and independence in their home and maintain their connection into the community, which is really, really important. Many of you have probably heard of the workforce shortage that exists today and affects many of the home care and healthcare providers. CDPAP, certainly from my experience, is one that has been fairly resistant to that and been able to continue to provide these services. The personal assistants and the aides that help these individuals really are the heroes. They never stopped going to work. They never stopped helping these folks who do need assistance to be healthy and stay strong over the past year and a half. So to that end, I thank them for all that they have done. My team and every other fiscal intermediary, our team, have continued to show up for work every day to make sure that these folks receive the services that they need. So I am passionate about defending them as well as the people we serve. The pandemic certainly has taught us a few things about what we value for individuals. The folks that are home, we try to keep them home just a little bit longer. Nursing homes, assisted living facilities, they certainly play a very important part in the continuum of care for individuals. But before we get to that point, giving folks the ability to stay home in an environment that they know, with their pets, surrounded by friends and family and the familial home, is extremely important for folks. And this program works very hard to enable that for them. Our board, our association is really trying to make sure that the voice of the providers who help provide these services for those are heard. And we are disappointed with the decision to move forward with the RFO as it was stated. Very appreciative of the legislation and the budget amendments that were passed last year, but we feel it's just not enough. Should the proposed RFO, request for offers, that will limit the provider network by up to 80% go through, it's going to limit access to this program for the people that need it the most. These are vulnerable New Yorkers, and it's not right. I'm passionate that it needs to be kept open and available to those that need it, and it needs to be supported by people that are local, and that is one of the things that are lost, certainly in the Onondaga area, especially highlights where not one was selected. So, you know, I urge our legislature, and I urge the governor to step in and make some changes, allow this to go forward. Thank you.
Thank you very much, Rick. Thank you for your advocacy for around the state and making sure that issues like home care stay as a very high priority. And I appreciate you coming here today. Next up, speaking from Access CNY is Paul Jocelyn.
Thank you, Senator. Thank you all for being here. My name is Paul Jocelyn. I'm the Executive Director of Access CNY, based here in Syracuse. Access CNY supports over 3,000 individuals with either a developmental disability, a mental health diagnosis, or a physical disability. We employ 1,400 people and operate over 30 programs, most of which are right here in Onondaga County. With respect to the CDPAP program, the Consumer Directed Personal Assistance Program, we employ over 700 individuals and support over 550 people. A little bit about those 550 people: 45% of them use a language other than English as their primary language, 25% of them have a disability, and 48%, almost half, are over 65 years old. We've invited a couple of our service recipients here to speak today. Agnes McCrae is one. Another gentleman who is unable to make it wrote a letter, and I would like to read that now. This is from Fred Powers. Thank you for giving me the opportunity to lend my support for our local fiscal intermediaries. Having been a part of the Consumer Directed program since its inception in the early 1990s, I can express to you the importance it has played in the quality of my life. My disability is a C5 quadriplegia. My need for personal services is 7 days a week, 16 hours a day, due to the complexity and the secondary issues of my disability. I am married and my spouse is able to work full-time. Having Access CNY as our local contact has been instrumental to me. They provide me with a program manager who assists me with recruitment, hiring, training, and tracking hours, as well as a relief list of individuals in case of an emergency. Access CNY contacts me immediately if there's a missed punch in or punch out, ensuring care providers are paid for their entire shift. It is much easier to resolve an issue in a day or two as opposed to finding a care provider who is not paid at all for the hours they worked. And again, I would like to thank you for listening and ask you for your support in keeping our fiscal intermediaries local. The support they have provided me and continue to provide allows me to live independently and not in a long-term care facility. So Access CNY has provided the Consumer Directed program since 1992. We operated the program before there were even regulations through a demonstration project with Onondaga County, and I think it's accurate to say we were the first fiscal intermediary in all of upstate New York. Another important aspect of having local fiscal intermediaries that I wanted to mention is the swift coordination and collaboration with our other programs as needs arise, and I'll give you a couple examples of that. Access CNY also operates a clinic that provides physical, occupational, and speech therapies to people who need them. So if one of our consumer-directed individuals needs those services, we can give access to those services immediately. We also, through our trade program, have a large warehouse of adaptive equipment. Everything from shower chairs to grab bars to canes, crutches, wheelchair ramps. All of it is available to the public. Of course, also the individuals receiving the consumer-directed program, all free of charge. All we ask is that they return the equipment when it's done. So if someone has an incident, they need a wheelchair, they need a ramp, crutches, we can have that to them in the same day. If we don't have local fiscal intermediaries, that type of collaboration and coordination will not happen. Finally, I would like to thank Senator Mannion, Senator May, Assemblyman Sturpey for all the advocacy they've done with respect to the Consumer Directed Personal Assistance Program and for people with disabilities. Thank you.